Hello. Diarrhoea is one of the most common symptoms experienced by people with inflammatory bowel disease, which includes ulcerative colitis and Crohn's disease. Diarrhoea is defined as passing loose watery faeces or poo at least 3 times a day. It is often associated with cramping pains and a need to rush to the toilet. Diarrhoea happens when the colon, or large intestine, cannot absorb all of the fluid that is passing through it. During an IBD flare-up, the cells that line the colon become inflamed and don't work properly. They cannot absorb fluid properly, so your faeces become very watery. It is not just flare-ups that cause diarrhoea. There are other things that cause loose bowel movements or make it worse, including surgery. Sometimes people with IBD need to have part of their bowel removed in an operation. This can reduce the absorption of water and important salts, resulting in diarrhoea. Infections. Infections occur in people with and without IBD. If your doctor suspects an infection, they will carry out further tests. Gastroenteritis and Clostridium difficile, often called C. diff, are among infections that can affect the digestive system. Medication. A rare side effect of some medication is watery diarrhoea. This can be reduced by taking your tablets with food. If you're taking medication for other medical conditions, it would be a good idea to check whether diarrhoea is a side effect. Some people with IBD also have irritable bowel syndrome, or IBS, which is a separate condition, and some may have food sensitivities. Either of these possibilities can cause diarrhoea, even when your IBD is well controlled. Check with your doctor if you continue to experience diarrhoea, and also see a dietitian or nutritionist if you're concerned about potential food sensitivities. There are different treatments available for diarrhoea. You may be started on medication to treat your IBD, which aims to reduce inflammation and treat flare-ups, as well as preventing future flare-ups. After your doctor has ruled out an infection, you may be given anti-diarrheal medication such as codeine or loperamide. These medicines slow down your gut movement, allowing more time for water to be reabsorbed. However, you must not take these medications during an IBD flare-up. If you suffer from cramping pain with the diarrhoea, then antispasmodic drugs may be helpful. These relax the muscles in the intestine and slow down the movement of the bowel. There are other medications and treatments, such as bile salt drugs and bulking agents, that may improve the consistency of your poo. Your doctor can discuss these with you based on your own experience. Some people find that certain foods can make their diarrhoea worse. You could try eating small, frequent meals rather than infrequent, large meals, keeping a food diary to identify which foods cause diarrhoea and cutting these out, avoiding high fibre foods and spicy foods, and reducing your intake of caffeine and alcohol. If you suffer from problems such as leakage of faeces, called fecal incontinence, or sore skin due to diarrhoea, further advice is available. We know that some people find it upsetting or embarrassing to have symptoms such as diarrhoea, but remember, doctors and nurses are used to talking about these symptoms, so please don't hesitate to tell them about anything you're experiencing. That way, they can give you the best help possible. If you find your symptoms very distressing, or they limit your enjoyment of life to a great degree, you may want to talk to a counsellor or to other people with similar experiences. For more information, please speak to your doctor or your IBD specialist team, or visit the Crohn's and Colitis UK website.